All right.
Second, approval of the agenda.
As amended. All right. Recognition of the public. Do we have any public on the call this morning? That wish to speak?
I see Mr. Pickard apparently is here, but I'm not, and Tammy and Ms. Weatherford. But I guess they have nothing to say.
All right. Approval of the minutes from August 18th, 2020.
So moved.
Second.
All right. And report of the committee chair. I don't have any report at this point. Report of the consultant. Monthly projections. Mr. Shoup or Ms. Spraudling?
Hello. Let me try to share this report. You all can see it. This is the October report because we don't have the November numbers just yet. We usually get those around the 8th of the month after. All right, so can you all see the summary document?
Yes, ma'am.
Perfect. Okay, so like I said, this is for October, and everything since July has been really running in the black, which is great. So you can see on the health and RX, the monthly change was 223,000. So we're at about a positive of 707,910 for this plan year, starting July 1 of 2020. For dental, that change is always much smaller, but it is still positive, which is good. So that's 14,518 for this, for October, and then the year-to-date change since July 1 is 25. So important to note is the large losses down here. We have two that are tracking over $100,000. That's the point that we put them on here. One of those, the larger one, you can see they have actually termed from this plan. That has fluctuated up and down very small amounts because all of the claims are being settled, things are coming in, what have you. So that one is probably about done. The other one has come up a little bit, but that one is still active. And then also we keep underneath this section of the large losses, we actually also keep this running county stop loss fund. And so we get the amount that it would have cost if you all were buying stop loss insurance. Blue Cross provided that to us. And so I keep that, we use a composite number, multiply it times the number of employees. And so that's the amount that you all are setting aside kind of as your own stop loss insurance as we talked about. So far this year, it's running about $273,896 that you would have set aside or that you would have paid Blue Cross, but you're not because you don't have that stop loss policy. Last year, it was around $195,825. And then lastly is the PEPM, which is always interesting for us to look at. And I need to move your beautiful faces. Okay, so this is showing the blue line as the Health RX. So right now, we are really early in this plan year, but you all are still tracking, you're actually below even the 2010-11 PEPM on your health plan. And then also for the on-site clinic, the PEPM for that. So are there any questions about this report?
Yes, ma'am. I'd like to ask a question about our large losses and our running county stop loss fund. We're setting aside basically $274,000 this year. What does that fund look like in terms of health and projected losses as far as you see right now?
Well, honestly, it's covering it. I think you all have made a sound financial decision to not have that stop loss, because if you'll remember, you had a 500K policy and none of your large losses are coming anywhere close to that 500,000 level.
Right.
So, and by setting that money aside, you're just preparing yourself for if it does happen. And it's definitely possible that a large loss could hit that large, but that would be very, very big.
Okay.
So
I guess my question to you is this: as of today, with the large loss claims, what do we have close proximity reserves in that self-insurance area? I don't want to call it a fund, but it is kind of a fund.
That is the total, Anthony.
Yeah,
The 273
The 273 is the total.
That
Yeah,
is the
last
running
year-
total? I thought that was the running stop loss that we were gonna put in there for this year, the 274.
No.
Right. That's my number. The 273 is for this plan year. That's the running from, no, actually, no, it's not. I'm sorry. That's wrong.
That's
It's actually both.
Cumulative.
It's both. So it goes back the 195 and then we're adding each month, we're adding another amount. And it would be
Okay.
higher than
All
this.
right. I
It would
got
be
you.
higher.
Well, that's what I didn't understand. I thought we were
Sorry.
setting back for this year, the 274, but you're saying that's the running stop loss total in reserves.
Correct.
Okay, that's what I
We-
needed to know.
That's what I
Thank you.
thought. Okay.
Brittany, would those large claims have hit stop loss this year, the two, the
No.
terms and the active?
No, you
They
haven't
wouldn't have hit
had,
it, would they?
you've not had anybody hit that because it was a 500,000
Okay.
level. These
Okay.
folks are at one something, a little
Right,
over
140.
140 is your highest, and that
Okay.
one's term, so that one won't go over the 500, and I don't think this other active one will either.
Okay.
That's good. So basically, if we can go another couple of years, no matter if we do get somebody that with a $500,000 claim, we'll still be in pretty good shape. That was still a good move.
Right.
Correct?
Correct. It was still a good move. Even I don't want to talk about taking out that fund just because claims are getting bigger, drugs are
Right.
getting more expensive. We could have $1 million baby hit. You just don't ever know.
Well-
But I do want to say the 707 that's at the top of the page,
Mhm.
that amount is only on what's coming in on the income minus the expenses. So that number, as far as like a total reserve number, most likely you would actually need both of those numbers to know how much you're actually setting aside. But David
Right.
would have all of those specifics, and then he's got carryover from previous years as well.
But we don't need to do that. We need to continue this particular fund or account and actually probably have $1 million or more in reserves just in case we've got this large loss, and then we're protected, right? So we don't have to spend the money for the insurance, which we would have done anyway. So it's really win for the trust.
Correct.
Okay. All right. That's really the extent of my questions. I just want to make sure that, we made a good decision and that it is panning out or playing out in our favor.
Right, and I will also, I do these reports every single month and send those to Debbie for distribution. But if at any point there's ever any kind of negative number, or if there's a large loss that truly is really high, I would notify you all. But we haven't had one in the past. It's been a long time.
That's great.
Yeah.
Thank you.
Yes.
Any other questions for Ms. Sprawling? Mr. Shoup, you have anything this morning, sir? No. All right, thank you all. One-to-one reports, Ms. Berry.
Good morning.
Good morning.
I will attempt to share my screen and show you the agenda. We'll see how that goes. Oh, yeah, it's not going to go well. I emailed the report to Debbie. Debbie, are you able to share your screen? I have a Mac and it makes me do funny things to share my screen.
Let me see if I can.
I can certainly just read it and then we can.
Let me see if I can share it. Does
Yeah.
this help?
Yeah, David, if you can, that'd be
Does
good.
mine pop up?
We emailed it to everybody this morning.
I've got my copy.
Did mine pop up? I just said share it.
Yeah, it's there.
Yeah, we can see it. Awesome.
Yeah.
Thank you. Okay, perfect. So third quarter utilization was up from second quarter, which was good. We had 785 visits in the clinics and via telehealth. You guys had 126 telehealth visits. That's awesome. Telehealth utilization is really picking up, which is great. You'll see that there were 83 COVID tests for the third quarter. That's also picking up across the county. And then patient satisfaction remains very high at 97.5%. I'll say one of the biggest complaints right now in our survey comments is that we cannot schedule online. And we're trying to work that out a little bit where patients can somewhat schedule online, but where we can still screen and make sure that we're taking the right precautions before folks come into the clinics that could potentially have COVID. We gave 194 flu vaccines this year, which is really good. 177 in our on-site flu clinics, and then so far 17 in clinic. And then if you can scroll down just a little bit, I only had a couple of other items to talk about today, unless you guys have other things. So we are working to set up rapid COVID testing in the clinics and hope that we can start that potentially as early as next week. Supplies are very limited on rapid COVID testing at this time, and we're working with a couple of suppliers to try to get some more inventory. But essentially, we want to be able to rapid test really critical employees like the EMS workers and certain folks within the Board of Education who we really need to know quickly whether they can return to work or not. So again, we hope to have that kind of up and going next week, but I'll provide more details as I get more inventory information from our suppliers. And then the last thing I had on my list to discuss is just the service agreement renewal. You guys realigned your contract timeframe with the Board of Education's contract timeframe last year. And so that would put the contract ending in December technically. So we just need to kind of talk through what renewal looks like, and if there's a smaller group you want me to work with and present to the larger group, or how you want that to proceed going forward.
All right. Thank you, Ms. Berry. Leah, do we want to talk broadly about?
I think obviously because we're in the middle of this pandemic, we ought to just go ahead and renew at least for another year. I think I think right now would be an inappropriate time to try to bid and change. And I personally can tell you, I had a non-COVID related sickness, and could not have been more pleased with the service that I received. And so, I think we can do that. So.
Mr. Chairman,
Yes,
I
sir.
concur with our county attorney. She's exactly right. I also spoken with Dr. Phillips, and once we get on this same contract date, we'll match each other so we won't be disconnected. And I think that's a good move, especially right now. I will compliment Ashley. She's doing a fantastic job. These rapid COVID test machine and test is going to save the county a lot of money, because we've got people who have to be quarantined. They don't know if they can come back to work until they get a test. And I think, Ashley, you said that we'll be able to get the results in 30 minutes or something incredible like that. And that's going to help us, because we've constantly, even in the county administration building, got an isolated outbreak here or there. And then other employees are being exposed to those people. And we need to know, if we're going to continue to operate in a safe manner, who has been exposed, who has COVID, who doesn't have COVID. So you may want to address that, Ashley, but I appreciate it.
Yeah, absolutely. It will allow us to more quickly assess somebody, especially again, like those frontline workers that we really need on the field. So we can quickly say, hey, you're negative, and you can resume your normal activities. I will just mention too, as you think about offerings and things going forward, we have launched a behavioral health program with 1-to-1. Maybe something for you guys to consider and dig into. We have information with the Board of Education that we can see how many of their employees already utilize behavioral health services and the savings that it would present to them. We don't really have a tool to be able to do that with you all. I would love to look toward that as a future offering as well, but we have essentially a social worker, a licensed mental health nurse practitioner, and a licensed health counselor who can meet with patients and help them go through some of the issues that they're going through, and then prescribe medications if necessary to treat mental health issues. it's definitely something worthwhile and we can talk about more, but wanted to put that out there so you guys are aware.
That's great. Thank you. Are there any changes to the contract that you wanted to discuss today, or you just route that renewal to us?
Yeah, I will.
Okay.
Mr. Chairman, do we need to vote to go on and do that and to approve that upon review by the county attorney?
At this point, go ahead and get the contract to me. I don't think we vote till after we get the contract done.
Okay.
I just know that y'all have have recognized that we need to keep going, and we'll work it out from there.
When is that contract due?
Well, we're in, there's auto renewal, so I don't think there's a super big rush to get it done, but it would end the end of December.
All right.
Is it a 1-year renewal, Ms. Berry?
I think the Board of Education is looking at a 5-year renewal, so
5-year.
you guys can talk with them and figure out what you want to do. But we have 1-year automatic renewals on the current contract.
And I think at this point, we're going to have to just do the 1-year automatic renewal. You know,
Well, let me ask you this, Leah, and I understand your logic, but we're kind of tied to the Board of Education, even though the trusts are different. I guess we could go along, but then that would be a pretty overwhelming expense because a lot of the facilities are actually on school property. So how would that work?
and Anthony, and I agree with you, but ours has always been on an annual renewal. And so to make that big of a change, we would have to go through the bid process. So the easiest thing to do is just to continue on with the annual renewals and, you know, deal with it that way, unless y'all want to actually do the bid process. And I don't think right now is the time to do that.
No, I agree with you. That's not what we need to go through right now. Well, I'll just do this. I'll just make a motion, Mr. Chairman, that we get the county attorney to move forward with the 1-year contract, and then we'll approve it. Like Ms. Berry said, this will continue until our next meeting, and I guess we can approve it then. How about that?
Actually, Anthony, because it's an annual renewal, if you do nothing, it's going to renew for another year. It's just if we don't stop it, it keeps going.
So do we need to do anything then, Leah?
No, but I could see where they would want a new contract signed, but David and I can take care of that once we've gotten the, you know, kind of the direction from y'all that you don't want to stop it. We'll keep going forward.
All right, Mr. Chairman, I make a motion that we don't stop it, if that's what you want in the language.
We've got a motion. Is there a second?
Second.
Oh, thank you. Anything else, Ms. Berry?
No, that's it from me. Thank you.
Thank you. All right, report of the finance director.
We
Mr.
have a
Long.
question. We have a question
Oh.
first to back up from Mr. Pickard.
Oh, great. Morning, Chief.
Good morning, Mr. Chairman. Did the county buy the rapid tester, or does that belong to one-to-one?
So
We are-
the machines themselves will be split between the Board of Education and government. So
We're buying it, basically.
yeah.
Is that something that I could use for the occasional inmate who's presenting?
I don't know how that works as far as the trust goes. Leah, that's a legal question.
Probably not.
Probably not, because it's paid for by the trust. Now, is there a way, and Ashley, this is probably too complicated for y'all, would there be a way where y'all could just set a cost and then the jail could pay the trust?
Absolutely. I would think that we could invoice them for the cost of the tests and supplies, that kind of thing. And then.
Not the machine, though, right?
No, not the machine, but the actual
Just the cost
test.
of the materials.
Right.
Would
Okay.
that work, Aaron?
Yes, sir, because we were considering buying one for ourselves, but I don't know what would be the best to do economically. We don't have a lot of tests that we need, but when we do, they're very, very expensive.
So
What did we buy this machine for? Wasn't it about
So the machines that we're purchasing through our supplier are a little over $300. And then the test kits are $35, $37 a test. There was a supplier that you guys had a connection with, but they were much, much higher.
Right.
So it's not super expensive. I can put you on, like I can purchase one on your behalf and put you on a list to get it. It takes several weeks for it to get here, but I'm certainly glad to do that if you would like.
Let's talk offline about that.
Do you
Yeah,
want to
I think that might be
here?
a better solution if it's only $300 so that you don't have to
Yeah.
take them down there to her.
No, I'm paying 300, well, right at 300 a test for inmates as it is, so.
Wow.
Yeah, we can chat and help you out.
Okay.
Thank you.
Sure.
All right, great. Any other questions? Mr. Lawing?
The first item I have is the actuarial for the extra service credits for TCRS. And we had 91 employees at this point that's reported extra credits to us, and the deadline's passed. They vary all over the place, but the one thing we do need to tie down is how many years of service would have to be with Sumner County. I think I heard last time at the committee the last 10 years. Is if that's what you guys want me to run with, I'm going to go ahead and run forward to the actuarial. For instance, if it's a 20-year service credit requirement with the age limit, at least the last 10 would have to be with Sumner, and then the 30 years, the last 10 would have to be to Sumner, unless somebody objects. And then
Would you restate that, David? So that's a little confusing. You said the first 10 years and the last 10 years. Can you elaborate?
In other words, once you reach age 60, you're required to have currently 20 years of service with Sumner County. If we change that to 20 years with TCRS, then it would be the requirement that the last 10 years of that TCRS credit come from Sumner County.
I got
And then the other one is 30 years at any age. I think we should also make the requirement that the 30 years at any age at the last 10 years have to come from Sumner County.
Yep.
That way you just make sure they are vested with the county of a minimum of 10 years, the last 10 years.
Okay. I got you.
Unless somebody objects, I think that would be the best move. Because otherwise you may have some employees with 1 or 2 years coming in. It's a 12th hour and all the costs going to the trust. And then the other items, the financial, I'm sorry, Mr. Holt.
No, I said that'll keep our actuarial costs down too when you run it, right?
It should, and it's also going to capture the employees that spent some considerable time with your county also, or with our county, the county.
Thanks, sir.
And then the other item is the financials. I concur with the consultant. We've had a very good year. Not sure if COVID's trending it down because of delays, but we've had a very good year for dental and for the health at this point. Unless somebody has questions, the financial statements are attached, and we've picked up quite a bit of reserves this year to date.
How long would the actuarial study take, David?
Well, right now we're still working with them. One we needed for June 30, so as soon as they get that to us, I will try to engage them. But right now, because of COVID, it looks like there's a little bit of time it'll take. So I'm saying it's probably going to take at least 90 days to get them back.
Oh, okay.
And that's probably with a rush. And we just now got the credits, and we sent those to them, and we'll send them the assumptions, and then we'll see what the response is. But I'm guessing about 90 days we could probably have it back. And then on the financials, everything's looking really good. It was definitely the correct decision that there wasn't a necessity for a increase on the premium. So it looks like it's running quite well, unless Mr. Sheets or Miss Sprouting see something different.
Any questions for
That's
David?
the end of my report.
We need a motion to move forward on the actuarial.
No, sir, I will move forward based on what you told me earlier. Since it's not on the agenda,
Okay,
I'm just going to move forward without objection.
that's right. Thank you. All right. No old business, new business, retiree insurance changes in EOC. Is that you, Mr. Lawing?
Yes, sir. The first one is we were looking to EOC, and there's a couple of items that's been discussed in the committee, and time has passed, and they're interpreting differently. So I think we need to probably get a little clarification and make sure the EOC is clear and it's actually conveying what the committee wants. The first question I had, and I sent all of you an email, it is not, let me see if I can share my screen here with you, see if this helps off the actual email. Would that help instead of just reading it out? Let's see, share screen. See if I can get the right screen here. I got a few. Can everybody see the email?
Yes,
I
sir.
moved screens. Did it make a
Yes.
difference? Is it still on the same one? Okay. It's that first item where I've had it is not completely clear if employee must have county insurance at the time of retirement to be eligible for retiree insurance or only qualify for the last 5
David,
years.
you switched to a balance sheet.
Let me pull it back over the screen. I don't know if that made a difference. Is that it?
There.
Yes, sir.
Okay. Apparently you can't move screens if it's locked. But okay. but the first point is it is not completely clear if an employee must have county insurance at the time of retirement to be eligible for retiree insurance or only qualify for the last 5 years of active service. Me and Ms. Denon were talking. We believe the committee has actually approved that you have to have insurance for the last 5 years of service, but the actual EOC doesn't have that. So I think it's something the committee needs to clear up, and I would recommend that you require employees to have insurance for the last 5 years of active service. Because the reason being is the retiree insurance is considerably more expensive than non-retiree. So if they're not paying in at any of this time, they actually get a very large subsidy at the end of their after their service. And then the other one is also about dependent. It's not clear. In other words, if you decide to bring your dependent on, you have to pay 100%. But that 100% is based on a blended premium, so it's considerably cheaper than what the actual claims will probably be. So also, it's not clear if it's only required for the last 5 years or beyond on the actual insurance. And my recommendation would be that it would require the dependent to be on the insurance for the last 5 years of active service. And the last one is what me and Ms. Dennis think's been voted at some point too. The EOC does not specify that an employee must maintain insurance continually after they retire. In other words, they're not allowed to take the insurance, drop the insurance, and then reacquire the insurance. So my recommendation would be if they acquire retiree insurance at retirement time, that they would have to maintain it the whole time. But that's my recommendation, and I think that's what was discussed several times over the years.
Let me ask an obvious question, maybe, David, but just say this employee retires at age 55 and has met all the criteria, and their spouse has, and they have insurance for up to age 65. Once they go on Medicare, does this insurance go away? How does that work?
That's the way it already works. That's not a thing that we would recommend changing. It still goes away when you reach Medicare age.
Just wanted to ask the question. Thank you, sir.
Right. This is the more to do with at the time of retirement that you've had to have insurance for the last 5 years. And if you obtain retiree insurance, you have to keep it continually, and you can't drop it and add it and drop it and add it. That's
Right.
my two recommendations, and I think the committees has discussed that several times. But the way the EOC reads is not very clear, and it really leaves a lot to interpretation and argument at this point. But I'm recommending that we have those 3 points added in, that you have to have insurance for the last 5 years before retirement. If you pull a dependent on, they have to have insurance for the last 5 years before retirement. And if you take employee insurance, you can't drop it and take it back. That was my request of the committee to clear up the EOC for point A. And then then point B is currently the way our procedures are, and there's been some changes with, we have the preferred and non-preferred. For instance, if you are a existing employee and you decide not to do your physical or not to do your HRA or not to do your blood work, you'll go to the non-preferred plan and we'll charge you the extra $25. However, if you're a brand new employee and you don't do that, we will not give you insurance. So what we've got is a large disparity with our operations for new employees and existing. And my recommendation is that we treat them all the same. If you're a new employee and you don't do your HRA or physical, one or the other, and become compliant, then you actually go to the non-deferred plan and be charged the $25 a month in lieu of not being allowed on the plan. That way we kind of even those up. Does anybody have any questions?
David, I think the part B is much simpler to address, and I do think that we need to be consistent. across the board instead of saying that new employees won't be eligible for insurance. So I say my recommendation would be that they are allowed to get insurance. They might have to be on the standard plan if they don't want to do the blood work, but we do offer them insurance. But I'll tell you what, let me stop with that. Can we address that? And then I want to go back to part A.
Yes, sir. Any other questions about Part B?
I don't have any. I do have a question about Part A, though. Go ahead.
All right. Do we need to make a motion on Part B?
I'd go ahead and do that so that you got it.
Mr. Nipper,
Sir.
Tammy is having trouble with her microphone across the hall. I'm going to let her ask a question if that's okay.
Oh, yes, sir.
All right, sir, stand by. Emma?
Okay, is this just for EOC benefits as far as you have to be on the county insurance for 5 years prior to retirement? This is why I'm asking. Sonny and I carry Sonny on my insurance. I'm the primary carrier through the county, but we're both employees. So should he?
You would meet the requirement.
Yeah.
No, you would meet the requirement because he's on. In other words, you're a employee and he's a dependent, so you would both meet that requirement.
Okay, so he doesn't have to get off my insurance to be his own carrier. We don't have to have any.
No, that wasn't the intent. That may need to be something in the verbiage, but the intent was that the employee or dependent, which in this case Sonny would be a dependent, be covered the last 5 years and not just get on the plan once they retire.
Okay.
So no, he's already on the plan. So my understanding, Sonny's on the plan currently as a dependent.
Yes, correct.
Okay, yeah.
Okay.
David, I have a follow-up question on that. So I know if once the primary person reaches 65 because they are now eligible for Medicare, then they are dropped. What if it's like, I'm not sure Tammy and Sonny's relatives age to each other, but let's say,
Dependent say.
Okay, I was gonna say, what if Tammy's 2 years older than Sonny, and
Well,
Right.
Tammy's
We
like
currently-
35.
they get dropped when she reaches the age?
We currently have that. We currently have that where there's been people take the retiree insurance, they came off, and the dependents stay. That's what we've got right now. So some of the dependents, to say, for instance, if I met the requirements and I had a very young wife, then she could stay on there for many years. That's what we've got right now. But 65, and that's my understanding, Leah, and make sure I'm not incorrect.
You're correct.
The
You're correct.
65 is per person, or actually Medicare is per person, not per policy, if that makes sense.
Thank you for clarifying that.
So David, one more question if I can. So let's use Tammy and the sheriff in the situation as an example since she brought it up. So if Tammy is the primary, she's carrying the insurance and the sheriff is the dependent. At some point, well, so when the sheriff retires, then he's going to have to pay 100% of his premiums, correct?
I think that's something you guys may need to address, but here's what I've noticed anyway. Think of Tammy and Sonny. If they both met the requirements, they would at retirement want to split policies anyway, because the county would pay, she would just have to pay 25% of hers and Sonny would have to pay 25% of his.
Right.
If you even the dependent, he's going to have to pay 100%. But I think when we do this language, we need to say if they're both county employees and they're both, have insurance for the last 5 years through the county, they still qualify. Because it wouldn't make sense for Tammy and Mr. Weatherford or Mr. and Mrs. Weatherford to keep a plan together, if that makes sense. Does that make sense what I'm saying?
Well, we're going to
pay 100% dependent.
That's fine, David. Are we going to clarify that?
I think.
Yes,
I think
and that's
you do
not
need to
clear on it right
clarify
now.
that.
Yeah, and it's not clear right now either. That's a good point. There's a lot of things in the EOC that need to be clarified. And I think one of the clarifications need to be if you are both county employees and you have insurance through the trust the last 5 years that you qualify for the plan. That's the only language you'd really need. Because that
Right,
means
because-
Sonny would qualify and so would Miss Weatherford. And that means they could take 2 singles or a combined, which probably 2 singles is cheaper, to be honest, but I'd have to look for sure. Sorry, Miss Leah.
Well, no, I just think because it makes no sense to make them both go to single right now, that's probably not
No.
cost effective for
My
both
point
sides.
is
So just say once they both
Yeah.
retire, they would qualify for that if they both were employees and meet
Right.
that criteria.
right. That's why I'm saying the language. If the language said if you are covered by the county's insurance for the last 5 years, you qualify for the retiree insurance plan. If you put that language, they both qualify together or individually once they retire. If that makes sense
Right.
for that provision.
Yep, I like it.
Mr. Chairman,
Yes, sir, Mr. Shoup.
we concur with A. Without this, you have adverse selection, which what that means is it allows people to come on the plan only when they need it, which means we're not planning for an ongoing condition. It just suddenly appears. And so we concur with David on A, on these points.
Thank you, sir. Any more discussion on A? David, when would these changes go into effect?
They're not clear on the EOC right now, so I'd recommend you try to make them effective as soon as we can get Blue Cross Blue Shield to put them into our EOC. And right now, the issue we've kind of got, and that maybe need to be something that needs to be a little bit addressed with Blue Cross Blue Shield, it's kind of hard to get EOC changes quickly. So I think what we need to do is go ahead and send it to Blue Cross Blue Shield now, and maybe even ask them if they can do an addendum or something to tell, but we need to get our EOC updated. Because it needs, every time I start looking at it to interpret what we've got, it's not the clearest document to follow along with, is the nicest way to put it. And it needs, that's my point, but it needs to be as soon as possible because it's not clear at this point. Maybe it's the way it needs to be verbiaged.
And then it would be just effective for prospective retirees. It wouldn't change anything for
Yeah.
anyone, right?
Yes, and
Right.
one other clarification, even after you agree to whatever you agree to, there are notification requirements. So that's going to take some time as well. So that needs to be blended into whatever effective date you have. You can't just vote on it today and it happened tomorrow. And Scott, that's correct, right?
I believe so. Bob, what it would probably require, and I can get confirmation from legal, is a summary of material modification to the existing EOC.
Yes.
And that's a much smaller document. That's something that can be provided and distributed much easier than the entire EOC. The only thing that I would ask is that we get specific as far as the type of language you want included in the EOC.
Right.
And we'll put them on the website. So would it be maybe March 1st? Would that be realistic?
I would hope I could get it to you before then. I will say this, we are obviously in the busiest part of our year with 1/1 renewals and 1/1 legal documents, but I think March 1 would be a very easily attainable date, yes.
And then we could do so you could do the summary of material modification now. And then when we do our new EOC for the July 1 of 2021, then we could redo it.
Well, the summary of material modification would be included in the July 1, 2021.
Right. We would just want a restated document. So we'll just have like a few months where people are looking at 2 documents for eligibility criteria. And then when we start the new plan year, it'll all be in just that one document for the
Right.
EOC.
That makes sense.
Yeah. And I don't
Because
think
we
that
want
would be
to
clear
be on the
enough
website.
Mhm.
on eligibility. You've
So
got
when
to
we do
spell it
these
out.
changes, so when we do these changes, is that something that we'll need to do as a county notify people, or is that something Blue Cross Blue Shield sends one of those notifications?
It would be up to the county. If I'm not mistaken, though, you would meet your requirements by making it available online at some point.
Right. It just
Well,
needs
but
to
I
be
mean, I want to make sure the
posted.
employees know.
It
Yeah, well,
needs-
we'll post it online, but we may want to email all the employees if it's not going to be a mailing from Blue Cross. That's why I was trying to determine. Because if nobody knows about it, it's not really going to do a lot of good.
Right. So legally, you're required to post it by the with the plan document, but I think you could email people just to kind of give them a heads up that this is what's going, the new eligibility criteria, just to make that available.
Okay. So we'll email them from here and then post it on the website once we get it through Blue Cross in March. Let everybody know if it's approved.
That's great. Thank you. Any other questions related to A or B? All right. Do we need a motion to move forward with those?
So move, Mr. Chairman.
And I'll second it, but can David or somebody who can eloquently speak and put all this stuff together, just restate the motion so we can all be clear on the motion that we're going to vote on? Because we had a lot of stuff in there.
Yes, sir. Thank you.
Those three and the additional one that was added. Let me get back to the email. Make sure I get the right. Okay. Oh, and I moved it again. Okay, let me move it back since we can't do that. Okay. The one that was going to be added was, that's not on under item A, was if an employee or dependent is on the insurance for the last 5 years, they will be eligible. They will meet this eligibility requirement for the retiree health insurance. They will meet A and B, if that makes sense. That's like where you have Mr. and Mrs. Weatherford. That'll make them meet the requirement for the 5-year requirement. The first requirement is for the last 5 years, you must have insurance to be, must have county insurance as an employee to qualify for retiree insurance. The other one is a dependent must have the insurance for the last 5 years to be qualified for retiree insurance. And then as stated earlier, if an employee or dependent, because they're combined, has insurance in one form or the other with the county for the last 5 years, they meet the requirement for A and B. And then requirement C is that someone has to select retiree insurance at the time of retirement, and if any time they drop the insurance, they're no longer eligible to reobtain it.
All right. Second.
It's a long motion.
Could you repeat that now?
Oh. All right, great. And then related to B there, do we need a motion for it as well?
I think we already did that, didn't we?
Did we? Okay.
They didn't vote on it, I don't believe.
Oh, they didn't? Okay.
Debbie did get voted.
I may have
Debbie,
just
was there a
missed it.
vote on it? I thought there was a motion, but then we got back to A, and I don't know if there's ever a vote.
I'm not Debbie, but you guys didn't vote on it.
Oh, okay. I didn't think so, but I wasn't 100%.
So I don't even think there was a motion that was made. I'll make the motion that the requirement for new hires would be consistent for existing employees as far as offering the standard plan versus the preferred plan based on the willingness of the employee to submit to the blood test.
I'll second that, but wow, Mike, you're as long-winded as David.
That was an
Try not
eloquent
to be.
motion.
Yeah. I have my moments. They're few and far between, but I do have my moments.
All right, without objection, wonderful. Thank you all. Anything else you want to discuss this morning? Good deal. One more motion.
Motion to adjourn.
Thank you all for
Thank
joining us
you.
this morning.
See you guys. Hey, by the way, you two, thanks for your great work last night. I think you appointed a great county commissioner. Thanks for supporting the park plan. So.
Thank
See
you. You all be safe. Thanks.
All right. Thank you. Bye.